Welcome to this Lifestyle Medicine from the Inside Out micro-learning series that looks at this connection between healthy lifestyles and positive psychology. And today's segment focuses on social connection, which is itself the heart of positive psychology. It's a major intervention, if you will, that's in the broader field of positive psychology. And what we know from a lot of uh, uh, well-done research, and lately it's been also made very popular by publications from Dr. Julian Holt-Lunstad, is that social isolation is associated with greater morbidity and greater depression, poor mental health, and poor physical health and mortality. And then the converse is true, that social connection, and we have many studies that show that social connection is associated with health and well-being, associated with lower blood sugars, healthy body weight, improved survival from cancer, from cardiovascular disease, improved mental health, lower depressive symptoms, better management of post-traumatic stress symptoms, and overall happiness and longevity. So social connection is so powerful. In fact, really, it is the most powerful component of the 6 lifestyle medicine pillars. And there are a number of studies that are long-term cohort studies, longitudinal studies, that are able to tease out some confounding variables and show that indeed this is true. And it's consistent across gender and length of follow-up and world region. There was a big meta-analysis of 148 studies with over 300,000 participants that showed that stronger relationships were associated with 50% increase in likelihood of survival. And this was consistent across age, sex, no matter the initial health status of the individuals or the cause of death or follow-up. So very, very powerful. And one of the most commonly known studies that has been highlighted recently is the Harvard Adult Development Study that shows this. And this has now been made popular by Dr. Waldinger, who is the principal investigator of the study with his recent book, The Good Life. But bottom line is, in this study, they compared inner city Boston boys with Harvard college boys and followed them over more than 8 decades. And now their families, their kids and grandkids and families, initially all boys, now they're including women, have collected a lot of data and really looked at a variety of confounding variables to really hone down that the single most important factor in our physical health, longevity, certainly our mental health and emotional health, is a social connection. And we know that then this is an important element of a healthy lifestyle that we need to be talking to patients about. This is something that we can assess. We can assess the quality and quantity of relationships that our patients have, because we are talking about positive relationships adding to one's well-being. We're not talking about negative relationships. And this is a powerful intervention, a powerful element of a healthy lifestyle. But in this Lifestyle Medicine from the Inside Out series, we've also emphasized this reinforcing reciprocal link. And so you might not be as aware that well, you, I'm sure, are aware that social connection works through the parasympathetic nervous system and releases of oxytocin and increases in vagal tone. But what you may not be aware of is that individuals who start out with higher vagal tone levels are more likely to increase their connectedness and more rapidly and have positive emotions more rapidly as a result of engaging in social connections. So there's this, again, a reinforcing reciprocal link. Social connections boost vagal tone, boost the parasympathetic nervous system, which is so good for us to lower our blood sugar, our cortisol, our blood pressure levels. But that if you start out with higher vagal tones, then that predisposes you to easier time with making those positive social connections and experiencing positive emotions. And so this is very interesting. I'd love to see more research on that. But in the meantime, the practical aspects of social connection are something that we need to talk to our patients about, and of course be aware of for our own well-being. So when we dig further, what does a positive social connection mean? Well, it means that we're engaged in these positive interpersonal processes. So it's like laughing together, doing kind acts for others, where you're feeling you're being altruistic to someone else, they're feeling your kindness, and it's a reciprocal. It goes both ways. You're both benefiting from that interaction, and probably you, as the altruistic person, the one doing kind acts, may benefit even more than the recipient. Other interpersonal processes that are vital to positive relationships are expressing gratitude and appreciation for each other. And this can happen with family and friends and deep and intimate relationships, but it can also happen even with strangers if we have very brief even just micro moments of authentic positive connections. It can be with the grocery store checker, someone that you say hello to when you're crossing the street, etc. And there have been a few studies that have borne this out. I'd love to see more studies. There's a study that showed that students who reported engaging more with classmates more than usual on those days, they reported greater levels of happiness and feelings of belonging. And so as we close this Lifestyle Medicine from the Inside Out series, I'm delighted to really end with this most powerful component of positive psychology that needs to be embedded in healthy lifestyles. And again, to remind you, our audience, about that wonderful connection between positive psychology and lifestyle medicine. Again, we can keep an eye out more informally, as well as engage in more formal assessments with our patients in terms of what they're engaging with in terms of positive psychology activities and interventions. And particularly, we can assess their social connections and the quality and quantity of those connections so that we can start to prescribe more positive psychology interventions. We can prescribe social connection, and that might be in the form of helping them to find digital websites, apps, and other places where they can learn more how to engage in these activities. But at a minimum, just brief reminders to them about finding ways to laugh more with others, be kind, share in gratitude experiences. It goes a long ways to helping them to achieve their health and well-being goals and to promote longevity. And through that process, if we're having a positive interaction with our patients and feel the meaning of engaging with our patients and express in kind ways, in supportive ways to them, then of course we are in turn benefiting from that. We're having those positive interactions that benefit our own parasympathetic nervous systems, bring our own blood pressure down, our cortisol's blood sugars down, and contribute to our sense of well-being and vitality. So I hope that you've enjoyed this Lifestyle Medicine from the Inside Out series, and please consider engaging with the Global Positive Health Institute about our programs and resources. Check out the book. We're going to be unpacking more information from the book so that we can show, for example, how lifestyle medicine competencies can be practiced through the lens of positive psychology and positive health, and much more that's in the book. But stay tuned for future releases and microlearning series from the GPHI. And in the meantime, I wish you the very best. Be safe, be well, happy, healthy regards. Take care, everybody. Bye-bye.